My name is Otha Nichols, and today's topic is hypersexuality. What is hypersexuality? Hypersexuality is a trauma response that causes people to react in a sexual way when a certain trauma has happened to them. Some people call it sex addiction. Some people call it sexual compulsive disorder. And others just label it promiscuity. Well, is it really a disorder, or do people just want to have sex all the time? Well, this isn't a matter of sex drives. Hypersexuality actually talks about a function that happens in the brain that causes people to want to react sexually because of something that may have happened in their life. Allow me to break it down biologically so that it can make sense to you. And if you struggle with it, at the end, I'll give you some treatments and some ways that will help you to get over it. So let's start with how the brain works. First, we'll talk about a section of the brain called the amygdala. The amygdala, look at it as a loud car alarm. So when there's a trauma of any sort that happens in your life, that alarm goes off and it lets you know that something is wrong. Well, oftentimes, when there's sexual abuse or rape or anything that revolves around that arena, that topic, the amygdala sends that signal that danger, something's wrong. Well, after the amygdala sends the signal and you're no longer in danger, the body usually returns to its normal state. There's no more signals going out to say that there's danger and everything is okay. Except with trauma. With trauma patients, the amygdala, it actually overreacts. It reacts when it shouldn't react. It's like if you were sitting at home in your living room and you hear your car alarm going off, but nothing's touched it. Nothing's brushed past it, but it's going off. And you go and you cut it off and you go back in and you sit down, and maybe an hour later or maybe tomorrow, it goes off again. That's the amygdala saying, hey, there's danger there, when there actually may not be danger there. So what else happens? The prefrontal cortex, another area in the brain, this is actually responsible for our reason and our logic. You reason and you have logic and you think clearly when that prefrontal cortex is working the way it's supposed to. And then there's another area, the hippocampus. The hippocampus, it controls your memories, all your thoughts that come in, your memories, it goes right through that hippocampus. So with trauma, the hippocampus shrinks, it decreases in size. The prefrontal cortex, it shrinks and it decreases in size. So it's not being worked the way it should. So now all those memories and thoughts kind of get convoluted in your mind. They're just scrambled up in there. And meanwhile, the amygdala is still setting off alarms, or as we call them, triggers. And so now something that may have happened 30 years ago, 5 years ago, because of your hippocampus shrinking and decreasing in size, it jumbles everything up. So there's ruminating and intrusive thoughts just floating around in your mind. The thing that happened 10 years ago was sitting in your mind as if it just happened yesterday. And the amygdala is saying danger. So then what happens? We react. We react to danger. Well, in the case of hypersexuality, the reaction is sex. Having sex with a stranger or with multiple partners, maybe you're in a relationship, you're married, no matter what the case is, sex is kind of like food when people are depressed and they lean on it. It's what comforts you, so it makes you feel good. And when that happens, all sorts of things in your life can go wrong. But how do we fix it? How do we stop the amygdala from screaming danger? How do we stop the ruminating thoughts coming in from that hippocampus? And how do we think more clearly and strengthen that prefrontal cortex? Well, there are ways. One way is regular physical exercise. Physical exercise actually helps you to work those brain muscles in there. So when you exercise, there's research that shows that it strengthens the prefrontal cortex, it strengthens the hippocampus. There are mindful exercises like yoga and writing, and what they do is actually reduce the amygdala. It calms it down so it's not setting off false alarms anymore. So with mindfulness exercises and physical exercise, that's a good way, a good first step to reducing the trauma response of hypersexuality or compulsive sex disorder. Now, if those things don't work, seek treatment. There's plenty of therapy that helps also to bring that brain back to the place where it's supposed to be. You can look for a therapist at your doctor's office. You can ask for a sex therapist. You can test yourself and ask them if they have tests and things that can tell you whether or not you have sexual addiction. And if that is the case, there is help. It's not a hopeless cause. But today I just wanted to show you how it actually works in the brain, and that it's not just something that happens. People don't just want to have sex all the time. Again, this isn't sex drive, but this is hypersexuality, where I'm doing this even though I know that it could cause me harm in some way. Maybe it's not safe for me, or it's causing relationships to be destroyed in one way or the other, and it's ruining my life. There is a science to it, and with proper treatment, you can definitely get there.